Thank you very much. It's a great pleasure to be here. I must say this is a very environmental event. It's the first time I've ever been at a venue where there's wildlife participating, such as the lovely birds that have joined us at the ceiling. And what's so lovely about it is always a reminder of those wonderful chirping sounds at the signalized intersections for visual impairment. So, well planned. So we've heard some lovely stories. We see some lovely pictures of the vision of where we're all headed in terms of more livable, walkable street, more walkable community. I'm going to switch gears a little bit. I come from the public health sector, and I am going to be talking about the use of health evidence, really to make the case for complete streets. You all know what to do. You've heard it from the other experts. We in the public health community want to be there. We want to be your partners. Think of us as helping being the champions to indicate why what you're doing is so very important and to bring alongside the political element and so on, decision makers to help. So, just moving right along, what I want to talk about is this idea of partners with a common vision. I have a few slides about really the state of the health, and I want to make the connection between health quality and the health of the nation, of us in Ontario, of us in our city. I want to talk a bit about active transportation. It is a prescription for health, and a little bit about street design for better health, and just last slide about some of the initiatives we ourselves have underway. So we have one vision, we have many partners, and I just want to make sure that people realize that in the public health community, whether it's at the national, provincial, or local level, the call to action has emerged. And in terms of requirements, for example, from the Ministry of Health on the 37 health units in Ontario, there's very clear direction now to get involved in built environment and health issues. You can count on a go-forward basis, and in some cases already very established basis, that local medical officers of health, whether in Ontario, whether in Toronto, whether across Canada, can be part of your advocacy initiative because they will champion the health concern and why these directions are important. So I'm going to subject you to a few slides. Again, the notion here is the evidence. And at the bottom of some of these slides, you will see the scientific reference for the original study. But basically, obesity rates in Canadian adults are just skyrocketing with time. You see the difference here between the blue bar and the red bar. Blue bar is 1978, the red bar is 2004. And what's interesting about this slide is it shows it at different age groups, from young adults, age 18 to 24, and so on, to older adults. And what you see is not just a time trend of increasing obesity, you also see increasing rates of obesity in young people. And I think, as most of us know, and I speak from personal experience, you do pack on the weight as you get older. So if young people are already experiencing higher rates of obesity than has occurred in the past, you can just imagine where they will end up when they reach their 50s and 60s. It's a very alarming and concerning problem. The other issue, in addition to obesity, is the lack of physical activity. We have become a very sedentary society. Over 50% of adults living in Canada are not physically active enough to maintain or even improve health. We need physical activity to make us healthy. And it's particularly alarming among young adults and among teenagers how physical activity has disappeared from their lives. Diabetes rates are soaring. We hear about this all the time in the media. Here, the charts show, again, time trends and upward trend no matter what the age group is. You see it in young adults, and you see it in the upper bars as well, which is for men and women who are 50 and plus. So the actions and the activities and the exposures to sedentary behavior and excess weight in youth will compound and contribute to much greater problems as we age. It's not just about health. Health burden is also an economic burden. We need to think about our healthcare system. How will we afford to deal with this increased burden of healthcare as the population ages? And so here you have a chart that shows direct and indirect costs for different provinces. The province on the right is Ontario, and you see, for example, the annual economic burden of physical activity in Canada in terms of health. In terms of healthcare costs, direct and indirect, is $5.3 million. That's a lot of money. If you could redirect that money to some of the active transportation initiatives, you could go quite some distance to preventing some of this harm and some of this economic burden. The annual economic burden of obesity in Canada is about $4.3 billion. It's huge. So what do we need to do? We obviously need to build active transportation in everyday living. And what studies will show is that active transportation is at least as easily sustained as other forms of physical activity or exercise programs. Again, some very interesting research studies that have taken people and subjected them to very intense 6-month exercise programs. One is going to the gym, that traditional way that we think, and we talk to people to change their lifestyle, followed by a maintenance period. The other way is to get a customized program to them to enable them to physically navigate and be very active in their communities. And when you find those two strategies, they seem to be equally effective. What we know, of course, is that a gym membership, there's lack of access, not everyone can afford it, people don't necessarily have time. The path forward has to be to change our city, change our streets, change our communities, so that having the healthy choice is the easy choice. So it is easy to incorporate daily physical activity and going about in the community. Active transportation and prescription for health. The studies are increasingly showing that people who commute actively are fitter, they're less overweight or obese than those who use motorized modes. And they experience significant improvements in heart health and indicators of fitness, and experience an overall at least 11% reduction in cardiovascular risk, which means people who are physically active have like half the rate of heart attacks as people who are not. So this contributes to considerable health. It speaks to the issue of good street design and reduces injuries. Pedestrians, we all know, the fear of being out there in the city and certainly being on a bicycle is very strong, especially among parents. And we do know from the research that pedestrians and cyclists do face higher risks of fatality and injury per distance of travel than people who travel by car, bus, or rail. That's the facts. We can't escape the facts. However, in countries with better walking and cycling infrastructure, these differences decline, they practically disappear. And if you look at this chart, there's a cluster of injury rates for people in the United States. Of course, it does not include Portland. It must not include Portland because those injury rates are quite high. It's got Germany in the middle, and then on the right side, it's got a cluster from Netherlands. And it's measured in different ways. It's measured in terms of distant travel, pedestrian fatalities, and so on. Just want to point out for the United States that a very large bar on the right side of the U.S. cluster, which is orange, those are injuries. And compare that orange bar with the orange bar in Germany and the orange bar in the Netherlands. So the point is, if we design our streets to encompass multi-modes, make it safer for pedestrians and cyclists, we can get those injury rates and those safety statistics greatly improved. And we do not then need to have people fear being out on a bicycle. Again, some other studies, that concept of safety in numbers, we've heard it from other speakers. So here's some examples. The top right chart is the top two charts, the left side charts are from California, the charts on the right side are from Europe. These are pooled studies. And intuitively, with most risks, the more exposure you have to a hazard, in this case traffic, the greater the number of injuries. But in fact, what the studies show repeatedly is that the more people are out there cycling, the lower the rates of injuries. So injury and fatality rates decrease as active transportation mode shares increase. Again, another rationale why we need to really support the city infrastructure to allow active transportation. Another dimension to think about is mental health. Physical activity is good for mental health. And some of these major studies, these meta-analyses, show that incorporating physical activity into your day-to-day life is more effective for dealing with depression, sleep disorders, and so on than not. It's part of a treatment regime. And in some studies, it's shown to be about as effective as traditional interventions, i.e. drug-based interventions. So again, physical activity can help with mediating some of these issues. Again, this whole problem about benefits of active transportation, the different modes, and how does it stack up against traveling in a car, transferring your child to school in a car. In a Dutch study of switching from cars to bikes, the health benefits of physical activity from cycling were greater than risks from injury or hemorrhage. a very sophisticated study done. We know there is some risk for increased air pollution if you're out there right beside the road, let's say cycling. It's a certain amount. We also know that there is some slightly greater risk from injury. But when you then look at the health benefit of being physically active, that completely outweighs the risk from accidents and air pollution. So we have to think of the total benefit of active transportation, and the studies are demonstrating that. So we are able in the health community to say, get out there on your bikes, make the cities and streets safer, but get out there on your bikes, because overall it will protect your health. One of the speakers talked about this as well. Again, there's very strong evidence that lower speed limits are safer for pedestrians. Here's a chart that shows the probability of pedestrian fatality by impact of speed. And so what you find is that pedestrian fatality is on the vertical axis and speed is on the horizontal axis. You see this S-shaped curve. So as the speed increases above 30 kilometers per hour, there's this extreme increase in fatalities. So if collisions occur between vehicles and pedestrians, the severity of injury for pedestrians increases dramatically above vehicle speeds of 40 kilometers per hour. When you reach 50, it's really a whole lot higher. So again, it's a reason for reducing speed limits for vehicles in areas where we're trying to increase both cycling and pedestrian modes. Child-friendly street design. There's been a little bit of conversations about that, but we have to think of all ages, as was mentioned, but we also have to think of young children. And I think we all know the phenomenon that adults, in the old days, adults would have walked to or cycled to school when they were young. 71% of adults did so, and now only about 18% of their children do so. So we have become very sedentary. Our children have become very sedentary. Traffic-related injuries. This is a little bit of work that we've looked at from Toronto, and you see here in this chart that the rate of injuries per 100,000 population in Toronto is quite a bit higher, surprisingly, than Montreal or Vancouver. And of all traffic-related injuries in Toronto, about 18% involve cyclists or pedestrians. In 2008, about 2,000 injuries were reported by pedestrians and close to 1,000 that year for cyclists. But what's really, really concerning is that when we look at the time frames for Toronto for the last 10 years, it's a flat line. We are not seeing improvement. We are not reducing our pedestrian or our cycling injuries to any large degree. And we want it to go down the way we see in Portland, the way we see in New York City, where they've really implemented some wonderful street designs to improve the safety and the livability of their streets. The other idea is the equitable street design must protect everyone. Here's some work that we've looked at, looking at different quintiles, different socioeconomic groups. And basically, what we find is that the lowest socioeconomic group had 3 times the rate of pedestrian injuries as the highest. So injury prevention must account for inequities. We don't really know what the features are, but I think it's really important to look at where are the clusters of lower socioeconomic, high density of lower socioeconomic people living, and what is the nature of the street environment, the pedestrian environment, and the cycling environment around them. And are there some features that expose them to greater rates of injury? Here's an interesting study that came from Toronto, and it was when they, in the mid-90s, they took 4 lanes of traffic on 6 different street areas, 6 different arterial areas, and they slimmed it down and they reduced it to 2 lanes. And they also included parking and new trees and incorporation of bicycle-friendly design. And so what they found over 2 years, and probably it's even better now, but over the 2-year period, they found that average annual bicycle traffic increased by 23%, but the average annual motor vehicle traffic did not change. So it's an indication that people adjust, and it does get people out of cars and into cycling areas. The availability of transit and physical activity is also a very important thing to keep track of. If you have more transit stops in a neighborhood, it increases that it increases the likelihood that residents will be active. So higher density of bus stops or streetcar stops, just having greater access to public transit. And it's logical because people then will walk to that transit stop. And many times they can get their daily needs practice about 30 minutes of vigorous physical activity per day. They can get their daily physical activity needs just by walking, let's say, to the local public transit stop. Sorry. Okay. Okay, last slide. I've talked a lot about other studies, and I just wanted to say that we in Toronto Public Health ourselves are coming out with some new studies as well, and we expect the results in 2012, and we do hope that our own medical officer of health will help to generate some of these findings. Thank you.